Hi, I'm Claire Hepworth and talking today on behalf of the Buteyko Breathing Association. We'll introduce asthma and dysfunctional breathing and how Buteyko Breathing Techniques can help to manage symptoms. I'm going to relate it to a research paper that was published, and this is titled Assessing the Impact of Breathing Retraining on Asthma Symptoms and Dysfunctional Breathing in Children. The National Asthma BTS Sign Guidelines recognise that dysfunctional breathing can contribute to poor asthma control. Dysfunctional breathing can be described as an alteration in a normal biomechanical breathing pattern which causes intermittent or chronic symptoms. A dysfunctional breathing pattern can be observed as upper chest breathing as opposed to the normal diaphragmatic motion, and can also be seen as an irregular pattern, excessive sighing, mouth breathing, and higher respiratory rates. Dysfunctional breathing symptoms can mimic or worsen those of asthma, frequently described as breathlessness and chest tightness. So you can see how confusing it is for patients and clinicians to understand whether they have symptoms related to their asthma or their dysfunctional breathing. To have dysfunctional breathing, there will be an observed changed pattern in their breathing as well as symptoms, and for some people this might only be present during exercise. It is becoming increasingly known that breathing retraining can have a big impact on our patients' quality of life and their asthma symptoms. Buteyko Breathing is a holistic breathing retraining package that addresses the biochemical, biomechanical, and psychophysiological dimensions of dysfunctional breathing. It empowers patients to take control of their symptoms and reset a healthier, more effective breathing pattern. So what are Buteyko techniques? Nose breathing is a key part of Buteyko, as we know that the nose cleans, humidifies, and warms the inspired air. If a patient is breathing apically, they are using their accessory muscles, lifting their rib cage up, and it's often very quick. And this can occur even when the patient is at rest. This extra workload for the accessory muscles can cause muscle fatigue, and that can come with symptoms of chest tightness and pain, which can be again misinterpreted as asthma symptoms. Relaxed diaphragmatic breathing, on the other hand, is an efficient pattern that helps to relax the accessory muscles. The goal is for patients to have an automatic, nasal, and relaxed diaphragmatic breathing pattern at rest, and as much as possible with activity. There are also other Buteyko techniques, including the control and extended pause, which I'll discuss later. We published a paper looking at Buteyko breathing techniques, in addition to standard treatment in children with asthma. And for the next few slides, I'll discuss the results of this. 212 children were referred to the physiotherapy clinic at Alder Hey Hospital between 2015 in December and January 2017 with suspected dysfunctional breathing in addition to asthma. Referrals were from respiratory consultants and respiratory specialist nurses, or AHPs, and the mean patient age was 10 years old. 169 children attended 2 or more appointments and were included in the analysis. 63% of these patients were on step 1 to 3 of the old BTS sign guidelines, which was a maximum medication of inhaled corticosteroid, LABA, plus or minus an add-on. 37% of these patients were on step 4 to 5, which was a maximal medication of daily oral corticosteroids and/or biologics. Children attended a mean of 6 physiotherapy sessions, each one lasting up to an hour in duration. As you can see, patients received a combination of techniques, predominantly education and Buteyko breathing techniques. Every patient and their parents were educated around what a normal breathing pattern is and how a dysfunctional pattern can cause symptoms. 97% of children were taught continual nose breathing at rest and with activity, in addition to a normal breathing pattern and respiratory rate. Mouth tape was also used for those who it was indicated for and for those who were old enough. We published 59% of them were also taught more advanced Buteyko techniques, including the control and extended pause, reduced breathing and stop cough. Reduced breathing and stop cough will be discussed later. The controlled pause involves pausing the breath after exhalation and controlling breathing before and afterwards. And likewise, an extended pause is pausing the breath for longer using a distraction technique. Patients were advised to practice for a minimum of 10 minutes, twice a day, ideally aiming for 15 minutes, 3 times a day. So looking at the results, 55 children were aged 12 and above, and 93% of them completed the asthma control test on the first and final appointment. Very small numbers had incomplete data or didn't understand the questionnaire. Overall, there was a mean score improvement of 4.5, which was statistically and clinically significant. For the childhood asthma control test, there were 114 children aged 5 to 11, and 82% of them completed the questionnaire on first and final appointment. Again, only small numbers had incomplete data. Overall, there was a mean score improvement of 4.9, which was statistically and clinically significant. For the Nijmegen questionnaire, 67% of children completed this on the first and final appointment. There were larger numbers of children who did not understand the questionnaire, which isn't surprising as it was originally designed for adults. Overall, there was a mean score improvement of 9, which was a statistically significant improvement. For children who had a baseline score of 23 or over, had a mean score improvement of 13.5, compared to a score improvement of 7 in those with a baseline score of under 23. This shows that there was a statistically significant greater response to intervention for children who had more symptoms at baseline. There was no difference in results between children on step 1 to 3 therapy compared to step 4 to 5 in any of these outcome measures, suggesting that children responded well to the intervention regardless of the medication level that they were on. In addition to standard medical therapy, individually tailored interventions, including Buteyko Breathing Techniques, improved asthma control and dysfunctional breathing on children on all levels of asthma treatment. Thank you very much for listening, again on behalf of the Buteyko Breathing Association.